The Chief Clinical Governance Officer of the Kauvery Hospital is my guest here today on Going Beyond. Her name is Dr. Jothi Clara. She's here with us, and together she's giving me a very good idea of the whole way that nurses are trained in our country and how we really should be respecting them far more than we do. Now, Clara, I want to know, what is the role of this Indian Nursing Council?
Indian Nursing Council is a governing body,
right,
which governs the education system by putting in a regulation in the curriculum, the hours that has to be covered, and the number of ratio between a teacher and a student. So all these are governed by the Indian Nursing Council.
Right, but does the council itself look at salaries for nurses and building up an awareness of far more respect for our nurses? Let's take this one by one. Do they look at salary structure for nurses?
Indian Nursing Council cannot be dictating salary for nurses, but this is becoming a state issue, and it is coming as a government issue because the country is very complex in India.
Indeed, yes,
and
true.
It has got a state, health is a state affairs.
Yes.
And also when you see the labor laws, like it goes by minimum wages for people across country. So it is very complex. So Indian Nursing Council, they do not directly get involved with the salary status of the nurses.
Right. Talking about salaries itself, would a young nurse prefer to go into government service or go into private? Which is the better, which is the better place to be in for a nurse, even at the starting point of a career?
I cannot speak for the entire nurses,
yes,
but
please,
I could give my opinion.
Please.
In the past, yes, there was a greater attraction for government positions.
Really?
And even now, central government positions, like when AFMs, AIMS are going to get opened, people are much willing to go into AIMS.
Really?
Because they have, the salary structures are better.
Really? And is there more security?
They have a job security. Yes, they have a job security, and they are also having certain other perks added to it. So very safe, very comfortable, job is defined. So people like to go, the nurses would like to take up positions in the government and the quasi-government settings.
Right.
That is true. But of late, the government has introduced a different kind of pay structure for nurses, where they are taken in with very minimum wages, and the nurses are not very comfortable. Those who are in this particular cadre are not very comfortable. However, I heard that Health Secretary and from our registrar, Dr. Annie Kalaimati, that they will be working towards nurses' salary in Tamil Nadu.
Right. I want to ask you now about, is there sometimes an uneasy relationship, or is it a fine relationship between doctors and nurses? We do see sometimes in the newspapers some little reports that are not very healthy, and kind of makes me a bit angry when I read some of those reports.
When we see medical and nursing profession, they are inseparable. They work in hand in hand, and nursing always are either independent or interdependent. So the interdependency of nursing comes with the medical professionals, and same with the doctors. As long as a good surgeon's handicraft goes in the hands of a good nurse after surgery, he would not be successful. The clinical outcome is only when a nurse is able to take care of the patient after a surgery is done, after a procedure is done. So this is where like they complement each other. It's a complementing professional. Nurses complementing medical profession, and medical professional complement a nursing profession. When I talk to surgeons sometime, when they say that the nurses are not good and we don't want this particular nurse in my unit, I always tell them, after your surgery, when you come into the intensive care unit along with the intensivist to place the patient in the hands of the nurse in the ICU, have you ever described to the nurse that you had a very tough surgery and this patient has come into for a surgery with this critical risk? If it is a critical patient or very high risk patient, then you should explain to the nurse. So when the nurse understands that the surgery was tough and this patient is not a very clean patient for the surgery, have several other complications, the nurse would stretch forward and she will plan it in a better way to provide and support care. And this is very, very important. So, in the recent past, a few conferences where I have attended, I used to project a slide which is depicting a very good opera concert. So, when we see this, it comes to my mind like this: when you go for a concert, if at all we prepare for a concert, there should be a lot of rehearsal. There will be several days of sleepless nights where people slog and get ready for this concert. But when it comes to healthcare, we all are trained in isolation. Medical profession, nursing, paramedical, we all are trained in isolation. But on the first day, when we come in front of patient, we all are isolated individuals. So, I used to suggest to universities as well, there should be something called as integrated learning. At least in the final year, a nurse and a doctor and the paramedics should take a patient door to door. Right from the admission to discharge, they should take a project. So, they will understand how a doctor should communicate with the nurse, how a nurse works with the doctor, how the teamwork helps patient for a clinical outcome. This team-based learning is missing for nurses.
Right. That's a pity, because I hope that somebody like you, who's so senior now and could be working towards stuff like this. Right. I'm going to come back after a break and I'm going to ask you about a patient's respect for a nurse, and please stay right there. And you, of course, please don't go anywhere, because we're going to be right back here with you on Going Beyond.